TopMedTalk.
Welcome to TopMedTalk, the broadcasting arm of EBPOM, evidence-based perioperative medicine. Stand by for a healthy conversation. But first, the 2026 International Practicum on Cardiopulmonary Exercise Testing will be held from September the 16th to the 18th of this year. It is organised by iPoets, the International Perioperative Testing and Training Society. Come and join us at this premier educational event designed for clinicians, scientists and healthcare professionals interested in sport, exercise and perioperative medicine. Check out ebpom.org for the best prices and information now. That's ebpom.org. And remember, this is an International Perioperative Testing and Training Society accredited event. So when you attend, you can get your iPoets accreditation showing that you are a practitioner who has reached a high standardized level of competence in performing and interpreting cardiopulmonary exercise testing for patients preparing for major surgery. Check out ebpom.org now.
Hello and welcome to TopMedTalk. My name's Mike Grocott and I'm co-editor-in-chief of TopMedTalk. We're here at the International Anaesthesia Research Society, the IARS, alongside the Society of Critical Care Anesthesiologists, SOCCA, in the beautiful city of Montreal. This is day 2 of this wonderful meeting, and I have with me a very well-known to TopMedTalk co-host, Desiree. How are you?
I am good. A familiar voice is what.
A very familiar voice. Great to have you back.
It's good to be in the chair, Mike. It's been a long time. It's Desiree Chappell, former co-editor-in-chief of TopMedTalk. Now I am medical science liaison and director of medical affairs for BD Advanced Patient Monitoring. Just wanted to make sure that everybody knew my new position. So it's been great to kind of be back in the seat, have some amazing conversations over the last couple days. TopMedTalk here in Montreal at both SOAP, so the Society of Obstetric Anesthesia and Perinatology, and at IARS. And then we also have a team on the other side of the world.
It's been a very busy weekend. Yeah, we have a team in at ANZCA in New Zealand, so Kate Leslie and Andy Cumpsty.
Yep.
Recording, I think, pretty much as we speak.
Simultaneously.
Yeah. Lots of podcasting going on.
Yes, there is a lot. Well, Mike, I was really excited to grab a friend while we were here at IARS to hear a little bit about more work that's happening globally. And our friend today who's joined us is Dr. Faye Evans, who I had the privilege to meet for the first time in Marrakesh to hear more about her work. So Faye, it's so wonderful to have you with us.
Thank you for inviting me here today. It's nice to see new friends.
That's right.
And actually, Mike, I'd say we're old friends. So we've known each other for a bit.
Yeah.
So I'm a pediatric anesthesiologist. That's kind of my day job. I work at Boston Children's Hospital in the U.S. An amazing place, amazing care, amazing resources. And then I'd say the other kind of focus I have is in global health. And people always ask me, what does that mean? And I'd say my passion is around making sure that all children around the world have access to safe surgery and anesthesia. And, I think hopefully by the end of this talking to me, you'll kind of realize that's not really the reality.
Yeah, absolutely. Well, why don't you take us down this path? Because here at TopMedTalk, we've talked to global scholars in the past through the WFSA and the work that they're doing. I think what you do has been a different kind of track or working through the WFSA in a different way. So why don't you tell us a little bit about that?
It's been an amazing experience. And I'd say really, I look back on it and I think, how did I end up getting these amazing opportunities? And it's just kind of being at the right place at the right time sometimes. Yeah. But interestingly, you talk about the Global Scholars Program, which is a great program. A lot of those scholars I actually know and have had the opportunity to train. And they have come through some of the programs that we have developed at the WFSA. So I don't know if you had a chance to talk about this. I think it'd be worthwhile.
Yeah.
The last, and when you guys were in Marrakesh, did y'all talk about what the WFSA is?
A little bit, but why don't you tell us? Because you actually sit on the board of directors for that organization, correct?
Yeah, I've been involved with the WFSA now probably for 15 years. And a lot of people here in the U.S. will be like, what's the WFSA?
Really. Yeah.
And I always say, well, the WFSA is actually, it's really interesting. It's a global organization. It's a society of societies. Yeah. So it's really made up of over 150 member societies. So me as a member of the ASA, which is actually our largest member society, I'm a member of the WFSA, which is really unique. It's sometimes hard to get still down to that individual anesthesia provider and how they can get involved or kind of know what's going on. But a lot of what the WFSA is focused on is, advocacy, safety, quality, but they also run a fair number of educational programs that basically benefit, I'd say, anesthesiologists globally. Some of the programs, like their publications, like something like Anesthesia Tutorial of the Week, which is an amazing educational resource that folks here have never seen it. Really great snippets, clinical snippets to use for your trainees in the operating room. That's a resource that's very relevant wherever you work.
I was going to say, that's kind of a true global kind of education.
Yeah. But then a lot of our programs do focus on improving anesthesia care in the low and middle income countries or the under-resourced settings. And I've had the privilege to be involved in a bunch of those. And what's interesting is the global scholars, I've met so many of them by participating in those programs.
Oh, that's fantastic. So how long have you been on the board of directors for that organization?
I'm starting my second term. I was originally involved kind of through the SAFE program, Safe for Anesthesia from Education.
Yes.
And then I ended up on the education committee. I ended up chairing the education committee. And then for the past 2 years, I was the director of programs, which kind of handles a lot of the operational stuff. Our board is very much a working board. And then just recently, I became the director of partnerships.
Oh, yeah, that's right.
So it'll be really nice to go in that role only because I have so much programmatic knowledge. And hopefully I'll be able to help the WFSA raise more funds and awareness for the amazing programs that they run.
I agree. I think a lot of people don't really understand the role of WFSA.
I think I may be one of them.
Yeah.
So, I mean, I know... Terrible.
Seriously?
Well, I mean, I know WFSA in particular from the World Congresses.
Yes.
And those, you've kind of upped the pace recently because we had they've always been 4 yearly, but
they changed.
Sort of every 2 years now with the Marrakesh meeting, and we've got Vancouver coming up. But I think I'm less familiar with the programmatic work. So can you give us a bit of color on that?
Oh, it's amazing. Let's see, where do I start? Well, let's start with a couple of things. There's publications, which I touched on a little bit with Anesthesia Tutorial of the Week. And then they have another publication called Update in Anesthesia, which is not currently indexed, but we're hoping to make it indexed. It's a journal that's really an opportunity for authors who maybe don't have access to some other journals to be able to publish and to read because it's completely open access. And typically the way it's been run over the past couple of years is we've had themed issues on a variety of different topics. In fact, when I was chair of education, we had a education themed issue, which was really focused on how to teach and all the issues around education, around bedside teaching, implementation, assessment, things that anesthesiologists typically, when you're in an academic center, are often required to do, but never actually properly taught how to do, interestingly enough. In addition to that, we're starting something new. It's going to be called the AOLC, which is the Anesthesia Online Learning Community, which is going to make an ecosystem really online for all of the different things I'll be talking about. And then separate from that area, you have a lot of our short courses that we're involved with. Things like the SAFE program, which is a collaboration with the AAGBI, which I think you'd be familiar with, Mike.
I know these people well. In fact, I'm one of their members.
They're really interesting. It's basically short courses that offer refresher course training to folks who might not otherwise get the opportunity to have it in certain subspecialty areas. The first one was developed in obstetric anesthesia. There's now one for pediatric anesthesia, another subset of peds called Safe Peds Cleft. And then we also have, in addition to that, some new ones coming in the pipeline around critical care. Then we also have other short courses around patient blood management. We partner with other folks, a course called Inspire that's all about teaching. What courses am I leaving out? VAST is another one. It's not our course, but we partner with the folks who develop that. So again, lots of opportunity for these short courses, really geared towards physicians who are out there practicing to get some refresher course training in specific areas that they might not otherwise get.
But still for a global audience? Is it?
Yeah, originally I think many of them were developed more for a lower resource setting. However, what we're finding is many of them are being adapted and very relevant for our higher resource setting too. So I think you can't assume that. But, they're adaptable. I think that's the beauty of it. So, for example, Safe Peds, obviously something I'd be really interested in. I helped write it. I was part of that team. When we really initially implemented it was in Uganda. But then we took it to Latin America. We took it to Colombia. And what we did was just adapt it for that environment because the knowledge of some of the providers was just, they had more pediatric anesthesia knowledge around some more advanced topics, like at the time, ultrasound guided regional. And they wanted more. So we just built it into the course. So they're 3-day courses. They're based on adult learning principles. They're not typically like lectures, like you go to a conference and you sit. Way more interactive, way more short, small group work. a lot more hands-on work. So a lot of fun. And then the other area, I'd say the other big area, and I'm probably going to leave something out, is our fellowship program, which is pretty impressive. For those of you who aren't familiar with it, the WFSA doesn't run fellowship programs, but what it does is help administer them. So
you're like a dating agency, that kind
Yeah, kind of. But what happens, it offers opportunities for folks, particularly in low and middle income countries, who want to do a subspecialty fellowship in some area, whether it be pediatric, obstetric, regional, cardiac, simulation, research. It offers them the chance to do a subspecialty fellowship. We try to promote doing it somewhere nearby so the fellowship is relevant with resources and infrastructure to where they currently work. It provides funding support to do that. And this is something that otherwise wouldn't have happened. And the idea is not just to improve the individual's knowledge and skills. Our expectation is they will then take that new knowledge and skills, take it home, educate, teach, lead, really be the change makers in that wherever they are living. Anyways, the program's been going on. It started about 25 years ago. The first one was actually, so what'll happen is the WFSA doesn't create them. They'll have a partner institution somewhere. The first one was actually in Thailand, in Bangkok. And they were wanted to offer some training for neighboring countries, and they went to the WFSA to help make it happen. And so it was actually an advanced anesthesia skills fellowship. Yeah, and it's still running. And that was kind of the first one 25 years ago. Pretty amazing.
And then globally, these are happening in all corners of the world.
Yeah, they are. I'd say there's a really nice map on the WFSA website under their fellowship program where you can learn a lot more about them. But right now, I'd say, so first year they did it in 1996, there were 3 fellows. Since then, we have trained over 400 fellows from 62 countries. A lot of the fellowship programs now, there's many in Africa, there's some in Europe, Asia. It's getting harder in some places actually to run the programs. We used to have one in Latin America, a few, but with licensing, allowing people to come from another country and get a license to actually practice, it is getting some places kind of tricky, but we're trying to find ways to work around that. But it is, it's a great opportunity.
Well, this idea of training somewhere else and really truly taking all of that knowledge back to your maybe under-resourced area, that specialty training, that's pretty amazing.
Yeah. And honestly, I hate to plug it, but I think the only limitation from us expanding it bigger, we always want to have more opportunities. Even today, I got an email from somebody in Rwanda saying, we want to start our own obstetric anesthesia fellowship. Can you help us? From the WFSA. Yeah. A lot of it's funding. We have partnering institutions that want to do it. We're there to help them develop it. They develop their own curriculum, but just as far as the logistics, because there are logistics involved that we've got a lot of experience with. It's really funding. I mean,
does that funding come from societies or individuals?
Yes.
Or
yes.
all of the above, industry?
Yeah, we could do a better job. I think, it's just finding that niche. Individuals who are incredibly generous, who have some tie to the place. Societies, I have to say, there's the Pediatric Anesthesia Fellowship Program in Nairobi, which really was the first subspecialty fellowship of any kind on the continent of Africa. Wow. And that started in 2013. That one of the fellows, they have 3 fellows every year. One of the fellows has been funded by the Society for Pediatric Anesthesia since it started every year.
Nice.
Just really have committed to it.
Yeah.
And, it's funders like that, those long-term partnerships, they see the benefit, they see the impact these folks can have. Yeah. That's how the program continues.
That's fantastic. And what part of the fellowship, because I would imagine that there's the clinical aspect of this, but also there's some soft skills, as I like to say, that are more about change management. How do all of that, is that part of the program, or is that kind of like mentorship and things like that?
Leadership skills, right? And those non-technical skills. Becoming more, I think, so I forgot to mention one of the new courses at the WFSA is a leadership course, because we're realizing that leadership skills are so important.
Yes.
I think originally when the fellowship program got started, it was really about knowledge and skills. It's evolved.
Sure.
And I think we're realizing that incorporating leadership, how to teach those things into the programs is really important. And actually, even some folks really want research exposure. So what we've done is actually created a system where we actually send out a survey to the person after they've a pre-fellowship kind of survey before they start to say, what are your goals? You obviously know what the fellowship's on, but what are your individual goals? And then we give that to the program director so that they actually know if there's some specific things that they feel like they're weak in, that they could get better and try to help them.
Yeah.
And sometimes you're limited by the length of the fellowship because they
Sure.
can be anywhere from 3 months to a year.
Gotcha. Yeah.
So you got to do what you can do in that finite period of time.
Sure.
But the nice thing is then the fellowship knows, and then basically we'll then ask them again at the end of the fellowship, did you achieve your goals? And then we actually reach out to them a year later, because we do think that monitoring and evaluation is super important for really being able to measure what you've done. And you can't measure it if you don't ask.
Yeah. Yeah, absolutely. So, so you've done all of this different work, but you are definitely focused more on the peds. Do you want to talk to us a little bit about the peds part?
I'm supposed to be, sometimes I feel like I need to wear my WFSA hat, which really is about all anesthesiologists.
Exactly.
And I'm committed to all of them. But the ped stuff is what I've been more involved with recently. So this is a really great example of kind of what can happen with a fellowship that's successful and what it can grow to build and the impact it can have. So I mentioned the WFSA, the Nairobi program, and that was a WFSA fellowship program, but it was actually in partnership with the University of Nairobi. So it had a academic partner. Not all of them do, but that's okay.
Okay.
You don't need to. You could have a hospital-based fellowship. It could be a university-based fellowship. Really, again, it's an opportunity to learn more. So we all of a sudden were having like 2 or 3 graduates from this program every year. And in 2000, I want to say, what year did COVID start? 20. So it must have been in 2019. A bunch of us who had, a bunch of people have been involved in this program, and a bunch of graduates were down at the Global Initiative in Children's Surgery meeting in Johannesburg. And it was right before COVID. And we were all like, hey guys, this is great. We met, we were just talking about how things were going. And what became very apparent is a lot of them were really interested in starting their own fellowship program. But they also realized there still might be only 1 or 2 pediatric anesthesiologists in the whole country.
Yeah.
So they're like, how do we do this? And we're like, well, the way we do it is we work together. And we're like, okay. So we formed something called PATA, and it stands for Pediatric Anesthesia Training in Africa. It's just a collaboration. It's not a program. It's not a foundation. It is a collaboration of people who are really vested in improving pediatric anesthesia care and training on the continent of Africa. Doesn't mean it couldn't be anywhere else, but just for right now.
Yeah.
And we decided our first goal was to expand fellowship training, because we felt like if we could get more educators and leaders and programs, then we could do all the other things we wanted to do.
Yeah.
So we spent COVID that time working on a curriculum that we developed together that had input mostly. I mean, our leadership team is basically from 8 African countries, and then there's 2 of us from the US, but everybody else is from the continent. And we developed this curriculum thinking it would be iterative. We wanted it to be adaptable and locally implemented. You know, it was just a starting point. You know, is it perfect? No, but we had to get it started. And then we looked to our partners and we said, okay, of you guys, who's ready to start a fellowship program? And 3 people raised their hand. It was the team in Abuja, Nigeria, the team in Uganda, and the team in Zambia. And what was unique about each one of them, or not unique, the same, is they all had the team. And the team is critical to be able to do this. They had a really supportive surgeon, pediatric surgeon, who was like, this is awesome.
Yeah.
They had the infrastructure. They all had a kids OR. That's another discussion. And then they had the person who wanted to start it. But they were all 3 different models, which is really interesting. So remember I mentioned before the program in Nairobi was a university-based. Well, the program in Abuja is going to be hospital-based. The program in Zambia is going to be university-based. And the program in Uganda was society-based. They have a partner university there at Macquarie, but they knew to get this approved, it was going to take 5 years. And we just wanted to start. We'd figure it all out later. Like, didn't matter. And they knew that they eventually would do all their local accrediting regional, you know, like societies, like, you know, you think of Connexa or WACS or any of those things, colleges. But for now, we just wanted to get started. So we're like, okay, great. So we've got the 3 sites. And then we're like, we got to find funding. So we went around and put together a proposal. And basically, we were really fortunate. We got 2 organizations that some of us have been involved with, Alma Philanthropies and Smile Train, who were willing to support us. And the original goal was we're going to start 5 new programs in 5 years. And I think we'll make that goal in the end. And so now we're in year 4. I'm almost done with year 4. And the programs, we have 4 programs up and running. And it's really, I've got a great figure to really show you the multiplier effect of how many more people we have trained on the continent.
Yeah.
Damn.
It's pretty cool.
We're no good with figures on the podcast.
I have a picture. The
we can
image
put it
is
in the
really
show
good.
notes.
The image is great.
Yeah,
It
yeah.
really does show you what you can do. And I have this other figure, like Mary Rose, who leads the fellowship in Nigeria is just such a great example because she was actually a WFSA fellow. And I think she told me, I think it's 2018 in Mumbai, India, because we have programs there too.
Mm-hmm.
She came back to Nigeria. Now she started her own program. And now she's like in leadership positions. She's basically the vice president of the Pediatric Anesthesia Society for Nigeria. She's the president of the Society of Specialists for Airway Management in Nigeria. She's the chair of the Workforce Wellbeing Committee for the Nigerian Society of Anesthesiologists. So there's somebody, you gave them the opportunity, and now look at all the stuff they're doing in their country. It's pretty amazing.
That's incredible. Oh my gosh, this work is so good. We could talk to you forever. I think that, though, what are some things that we, people listening to the podcast, wherever they are in the world, how can we get involved? How can we be supporters of all the great work that you guys are doing?
Honestly, we always need people to be involved, to teach, to educate. I'd say there's a lot of the WFSA programs. There's lots of opportunities to get involved, whether it's by traveling or virtually.
Yeah.
I mean, really, is COVID one of the blessings? Is really, I don't know if it's good or bad. Sometimes I'm
silver-
like, nothing turns off, right?
Yeah.
But the way that we are so connected, so much easier. So there's lots of opportunities to teach, to educate. Funding.
Yeah.
Being willing to give some funding to support these programs, I think is just as valuable as going and giving your time to doing something yourself. I hate to say it, but that is just as valuable and just as important, because it's without that funding support, we can't make these things happen.
Yeah. If someone wanted to give or wanted to be part of this organization and the work that you're doing, what's the best place to find all that information?
I'd say I'd go to the WFSA website,
Okay.
and there's definitely places. There's actually on there specifically for fellowships. I mean, there are lots of the programs there that you could support. I'd advocate for all of them, but specifically around fellowships, if you go to their site, there's a place where you can donate. For folks from the U.S., it's a 501c3.
Oh, there
That's
you go.
helpful.
Yeah.
And so you can donate there directly. And actually there's more information about all of our programs.
Yeah, I was going to say, we'll put a link to that on the show notes and make sure that we'll drive everybody there. And some of the figures and things that you were talking about,
Be
we're
great.
happy to add those in. So coming back around, so global health, it's interesting. Thank you for all the work that you've done. And I know you have lots of colleagues that you've been telling us about and the great work that's being done. That's amazing. Thank you so much.
It's a huge collaboration. I'd say if you're interested in global health, don't try to do it alone. You can't. There's so much work to be done, and you get so much further along if you just work with others and collaborate, and always look for opportunities to connect folks. I think that's one of my strengths is I'll meet folks. I'll be like, you should be working with this person. They could really help expand what you're doing. Or, these two organizations, you guys are working in the same space in silos. If you work together, A, you might be able to attract more funding, but B, you're going to be able to, A, not reinvent the wheel, not do the same thing in parallel, and be able to do so much more.
Yeah, absolutely. That additive effect, and it just keeps building and building
You
and
have to.
building.
You have
Yeah,
to.
that's awesome.
Yeah.
Well, Faye, thank you so much for sitting down with us.
Thank you so much. And so impressive, the kind of networking effects of teaching someone who sets up their own program and et cetera, et cetera. It's great to hear.
They're the amazing ones on the ground. I'm just there as part of the team.
Yeah.
Thank you, Faye.
Thanks.
So,
With
thank you
that.
all of you for listening to TopMedTalk, the broadcasting arm of EBPOM, evidence-based perioperative medicine. You can find us on our website, www.topmedtalk.com, on social media at Facebook, LinkedIn, X, as well as on our YouTube channel. Please like us if you like what you hear.
Yeah, thumbs up. Come on, give us all the likes, all the love. And if you have any comments, you want to hear more of something, let us know.
And please check out our back catalogue of more than 2,000 conversations that have been downloaded more than 2 million
You
times.
should see Faye's face right now.
Yeah,
She's
Faye's
shocked.
looking incredulous. And thank you to our wonderful hosts here at the IARS for supporting us, and of course to our sponsors GE and BD for enabling us to provide free, open access medical education to the world.
That's right. Cheers, everybody.
TopMedTalk.
And remember, the 2026 International Practicum on Cardiopulmonary Exercise Testing will be held from September the 16th to the 18th of this year. Come and join us at this premier educational event designed for clinicians, scientists and healthcare professionals interested in sport, exercise and perioperative medicine. Check out ebpom.org for the best prices and information now. That's ebpom.org.